A sharp political clash is now unfolding over the Kenya's health system. At the center of it is confidence, credibility, and the future of the national program. President William Ruto now has dismissed the claims by the former Deputy President Gachagua that the Social Health Authority (SHA) will collapse within 6 months, insisting the program is stable, operational, and already benefiting millions of Kenyans. He said that pengine Gachagua aliongea na wachawi.
Ndio unasikia wengine hata mwingine nasikia mwingine juzi ati ako na habari kwamba SHA ita collapse in 6 months. Kwa sababu mimi ni rais, nikajaribu kuchunguza hii habari alitoa wapi. Nikagundua kumbe alienda akaongea na waganga na wachawi ndio wakamwambia hiyo. Kwa sababu
The president's response on Wednesday, April 1st, during the Maendeleo ya Wanawake annual general meeting held at State House. At the event, the head of state used the platform to strongly defend the government's flagship health insurance program, rejected the claims about the possible collapse, and he questioned the credibility of the information behind those claims. According to the president, the Social Health Authority, commonly referred to as SHA, is functioning and as intended. He maintained that the program is not only stable but also expanding. He pointed to the registration numbers as evidence, so that more than 30 million Kenyans, he said, have already enrolled in the scheme, and that figure represents a significant portion of the population. It signals a high level of public uptake, and it reflects the government's push towards the universal health coverage. The president also highlighted the financial performance of the program, and within 1 year of its rollout, he said the government has paid out 121 billion shillings to hospitals across the country. This, he noted, is the highest amount ever disbursed to higher health facilities in Kenya's history with a similar time frame. These payments, according to the government, are meant to ensure that hospitals can continue offering services without interruption. They also aim to reduce the number or rather the burden of patients. A key objective of SHA is to protect families from catastrophic health expenses. For years, many households have now struggled to pay medical bills. In some cases, families have been forced to sell land, livestock, and also other assets to cover treatment costs. The government says the new system is designed to change that reality. Under SHA, registered members can access healthcare services with the costs covered through the insurance scheme. The president noted that many families are already experiencing this benefit. He pointed to cases where patients have had large medical bills settled through the program. Some of these, of those bills, he said, run into tens or even hundreds of thousands of shillings. And for the households, the program represents relief. It also represents a shift towards a more inclusive healthcare system. And however, even as the government highlights these gains, criticism has continued to emerge, and the former Deputy President Gachagua has been among the most vocal critics. He has raised concerns about the sustainability of the system. He has also questioned its financial stability. Speaking days earlier at a church service in Kirinyaga County, Gachagua warned of a looming crisis. He suggested that the program could collapse within 6 months. He linked this concern to what he described as growing challenges within the health sector.
I did say in Kirinyaga on Sunday that SHA, that monster created by William Ruto to rip off the Kenyan nation, we have credible information from experts that it will collapse within 6 months. Since then, Aden Duale has been ranting and writing tweets after every 5 minutes the whole night, and posting videos crying that all is well. From our first rally in town,
among them delays in payment to hospitals and broader questions about how the system is being managed. Those remarks have now drawn direct response from the president, and in his address, President Ruto dismissed the claims as unfounded. He described them as misleading, and he suggested they were driven by political motives rather than factual analysis. The president also accused critics of spreading misinformation. He argued that some of those criticizing the program have not taken time to understand how it works. Others, he said, may not have been even registered under the system. And this exchange highlights a growing divide between the president and his former deputy president, Gachagua. Once political allies, the two leaders are now on opposing sides of key national issues. Their disagreement over SHA is the latest in a series of public differences, and it reflects broader political tensions that have been building in recent months. Beyond the political dimension, the debate over SHA carries real implications for the public. Healthcare remains one of the most critical sectors in the country. Access to affordable treatment is a concern for millions of Kenyans, and uncertainty around a national health insurance program can affect public confidence. It can also influence how people seek medical care, and for healthcare providers, the issue is equally significant. Hospitals depend on timely payments to maintain operations. They rely on consistent funding to purchase supplies, pay staff, and also deliver services. Delays or disruptions in funding can have direct consequences. Patients may face longer waiting times, and facilities may struggle to provide certain treatments, and the overall service delivery can be affected. The government, however, maintains that the system is working. It insists that payments are being made and that the program is on a stable path. Officials argue that early challenges are part of the major reform, but they emphasize that progress is being made. The Social Health Authority is part of the broader effort to reform the healthcare sector. It seeks to replace older systems with a more comprehensive and inclusive model. The goal is to ensure that every Kenyan has access to quality healthcare without facing financial hardship. This vision is central to the government's policy agenda. It is also a key component of long-term development plans. As such, the success or failure of SHA will have lasting impact. It will shape public perception of healthcare reforms, and it will also influence future policy decisions. For now, the government is urging more Kenyans to register. It continues to promote the benefits of the program, and it is working to build trust among the public. At the same time, critics are calling for greater transparency. They are also raising questions about implementation, and they are pushing for accountability in how the system is managed. So the ongoing debate is likely to continue. It reflects differing views on how best to deliver healthcare, and it underscores the challenges of implementing large-scale reforms. As the discussion unfolds, the focus remains on outcomes, on whether the system delivers on its promises, and on whether it can sustain its operations over time. For millions of Kenyans, the stakes are high, and healthcare is not just a policy issue, it is a daily reality, and it affects families, livelihoods, and also the quality of life, and it remains one of the most important measures of national progress. And as leaders clash over its future, the true test of the Social Health Authority will not be in the debate, but in the care it delivers to every Kenyan who depends on it. That is all for today from Kenya Lens Media. Kindly, if you are new here, consider subscribing as a way of motivating us and also helping us grow this platform.